and I'm sure you've heard this from the other surgeons too, one of the minimally invasive surgery, which is laparoscopic surgery, was fully embraced here by the general surgeons. And we have a very young, aggressive group, you know, who are forward thinking, you know, they're doing some basic research, and, you know, they're really on the edge and they're up to date. And we are lacking in laparoscopic equipment. We would benefit from a minimally invasive suite, which is a fully equipped room that's totally designed to doing surgery that way. Both general surgery and urology and a lot of gynecology operates using laparoscopic equipment. In fact, we do more advanced laparoscopic colon procedures than Kelowna does, and yet we're behind in terms of equipment and funding. We just really have to beg and beg for every little thing that we get, which is really demoralizing, you know, for the surgeons here, and they're operating with less than optimal instruments, but have always just made done and yet still carried on. So that would be one huge thing. The other thing that would be that I think that this facility is outstanding in what it offers patients here is that the cooperation between general surgery, the breast surgeons, and the plastic surgeons in the management of breast cancer. We consistently offer anybody who needs a mastectomy to have immediate reconstruction, and I know that that's not offered at University of Alberta and many other institutions because of lack of cooperation, or, you know, it just doesn't work for my time or your time. But we consistently offer that, and everybody bends over backwards so that every woman here who needs a mastectomy, if it's possible, will have it done that way. And so it's just an amazing team that works really hard to make that happen. And they work on off days, and they cooperate, they give up time so that the patients get the best care. So I think it's amazing. And we have residents that come here from UBC and University of Alberta, and they're so impressed at how we pull that all together and how we pull that off here, because it doesn't happen in Edmonton at the university. So, and they tell us that. They say, wow, this is where they come and they learn how we do it all. Well, how we coordinate. We're also, it's just in its infancy, but there is putting together a breast clinic so that, and it will incorporate primary care, surgeons, diagnostic imaging, oncology, so that hopefully we can better coordinate the care of patients with breast cancer or other breast diseases. That's just getting off the ground. Of course, the other things that we really need are, you know, adequate funding in terms of beds and programs. This hospital is a workhorse. It just runs at over capacity all the time, and rarely does it have to cancel things. You know, it just keeps going and going, and it puts people here, there. And I know a lot of institutions do that, but this place is like, it really is phenomenal in what it's been able to do. And unfortunately, after a while, people burn out. You know, there are weak points, and things eventually break down, and people become demoralized, or, you know, they lose their enthusiasm or their creativity, and after a while, things start to give. And I think that's sad. I think the overcapacity has to be addressed. And partly that comes from the beds are plugged up by long-term care patients, or there aren't enough facilities or opportunities in the community, you know, that could take care of people either post-surgery or post-illness. You know, they just need some time to convalesce, and because they can't do it in the well, they either have to do it in the hospital or they go home, and there's sometimes you need some kind of transition phase